Have you ever thought about when you go to the doctor and you don't know what to ask about? Your voice matters. Hi, I'm Angel Mathis. I help women that's over 50 years of age that may have questions or concerns about their mind, their body, their health, their reproductive system. There are so many women that's struggling with menopause. They may be having struggles with sexual intimacy issues, just dryness, or anything that they may have struggles with regarding a woman of age. So I wanted to give you some key points to be able to think about and to be able to be confident when you speak with your doctor, because your voice matters. And when you make that known, when you're visiting your physician, they respect you more. Not that they're not, because they're so busy, their office may be moving so fast, they may not always take that time that you really need. So when you're there, I need you to be very confident. I need you to be very strong. And some people may say, Angel, I'm an introvert. I'm more inside person. I'm more passive. And then you may have some people that's a little bit more aggressive. But we want to kind of find a middle spot, a middle space or a middle spot for you. So when you're talking to your physician and you're asking them questions about your health, look in their eyes, and ask them, gear them towards you. Don't let them rush off and get so busy where they move into the next person and forget to ask. You may forget to ask them about your issues. So always, number one, ask confidently. Say, hey, what does this mean? After they spit off a lot of lab work, they talk about a lot of diagnoses, they talk about this, and that, and you're still not clear, or you may be by yourself, or you may not have a loved one with you, or you didn't write it down, or you may need to write it down. Ask those questions confidently. I want you to be confident when you speak to them. And look in their eyes, you don't have to, snarl up or anything, but you need to know what's going on. I want you to be very confident when you ask questions. When you also do that, they listen in. They understand, like, oh, this person, she's not going to rush me. She's not going to be rushed. She's not going to be confused. You know what I'm saying? It just kind of gears them, because you want to know what's going on. So I want you to ask questions confidently. Point number 2, once they tell you your situation, whatever it may be, you ask them, what are your options? Whether they're good or bad. It may be something simple. And most physicians, the ones I have, my doctor, or the ones I've worked with in the past, or I have managed different care issues with people about, they will tell them, you need this, 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 and that. So for an example, they may have a bladder infection where there's an infection going on in your urinary tract. And it could be from multiple of things. It could be dehydration. It could be not enough fluids. It could be it's just your body immune system are weak. They need to explain that and let you know if you need a culture or a test need to be taken. And also if you need to be on antibiotics, a medication. You need to ask. You need to know what your options are. And then go a little bit deeper, because everybody don't have insurance. Most pharmacies, they give you the initial generic brand. So they may give you a less expensive brand of medication so that you can be able to afford it. And that's a good thing. But then there's some pharmacists, they just put it on your card, your insurance. Sometimes you just have to just speak up. I want you to speak up about your care and be confident and ask your doctor, what are my options? And if you're having troubles with paying for medicines, and that you've been having troubles paying for your medications, you let them know that. Say, hey, doc, this is my situation. I'm having a financial difficulty. I need for you to make sure that we can get the medication I need and make sure that it's affordable. There are different ways that they can do to help you with that. So that's very important. Know your options. Whether it's going to be and how long like I say, if you have a good doctor, how long the medication, I'm going to be on that medicine. They'll tell you it'll be for 5 days. It'll be for 7 days. It may be for 10 days, and then The next step, you need to ask them about, are there any side effects that I may experience? Or do I may experience? And then sometimes, if you're not that type of person, when you're so exquisite, you're not a researcher, you're not going to ask a lot of deep questions. Usually your pharmacy or your pharmacist should be able to explain those things to you. But like I said, don't let them rush you. Make them take that time to explain to you what you're taking. And most of the time, even the pharmacist, they'll ask you and they'll tell you what the risks are. Do you have any questions? If you've been on the medicine before, then they'll ask you, and you may say yes or no. And they'll ask you, do you have any questions about it? And then you may say yes or no. But the part is, when I've experienced, when I've picked up medications, some of the pharmacists, they are very generalized. Not all of them. They're very generalized. Like I said, some of them don't go into full detail, which is understandable because they'll give you the information on paper. They will give you the risks. They'll give you the side effects or the interactions of the medication. They'll give you how much the medicine costs, how much your insurance pay for it. So they'll tell you all those details. So just ask questions confidently. Know your options. And because the reason why I instruct you, or I'm encouraging you to do this, sister, I'm asking you to do this, because when you understand how strong you are in terms of your care, you've been a good advocate. You are understanding that, hey, I need this information. It empowers you to make good, sound decisions. When you know about your disease process, when you know about your medications, when you're trying to figure out this and that, it really empowers you on how to move when you're making decisions. So I just wanted to share that with you so you can understand on which way and how to do that. Ask questions confidently, know your options, and know how to advocate. Now, I am an RN. I'm an RN advocator. I help patients or clients or women that may have questions regarding their medical condition, their disease processes, their lab results. I'm not a physician, but I can help steer you in the right direction in terms of what this lab work means, when to contact the doctor, those types of things. Like I said, most physicians, most hospitals, pharmacy, these places supposed to be prepared to set those things up for you. But I am there to go a little bit deeper. So if you have questions that we can get together and talk about and speak more on, you just need that boost to understand, like, oh, I didn't know I can ask about this particular test. Oh, Angel, I didn't know I can ask about that I need this particular blood work. Oh, I didn't know that I need to ask about, I needed to get my stool sample, a fecal sample or something done if you're having bleeding. Like I said, a good physician would know what to tell you and what tests for you to have, or that he'll give for you to get done. And that way he can have good results, that he can know what your results are, whether they're good or bad, you'll have adequate results. That's what I'm saying. So I just want to share that with you, to empower you, to be able to encourage you, to be able to be a good advocate with your care, and know and understand what your condition is, because your voice matters. It's very important, and it's very important that you understand that your care is important and that your voice matters. God bless you, and y'all continue to live anchored. Take care.